Good morning, everyone. Going to call to order. Is a quorum established?
Yes, Madam Chair, we do have a quorum this morning.
Great.
We'd like to introduce those board members.
We are going to introduce the people that are here in the room that came down today in a snowstorm. I'm Marilyn Massey, Chair, and this is Bea. And she's been chair for 3 years, and now she's here to mentor me. And we have Bill over here at the other side of the room that came all the way down the hill to join us today. And Jared's going to introduce those that are on the line.
Good morning. We're going to just call based on who we have in Zoom. Let's start with Eric.
Good morning, Eric Bidwell. I'm a manager with DHS in El Paso County and am part of the RAC.
All right, Jim Woodward.
Good morning.
Joanne Roof.
Joanne Ruth, Colorado Springs. I'm from my new apartment. So I'm very happy to be here. Sorry, I'm not in person.
Mary.
Hi, Mary Cap from El Paso County Representative. I'll be in and out this morning as I try to figure out how to use my new washing machine.
Jason.
Jason DeBueno, Silver Key.
All right, Jen.
Jen Nemo, Colorado Community Health Alliance, the Medicaid array for the Park, Teller, and El Paso counties. Also chair for the SRS.
Debbie.
Debbie Levin Stankiewicz, volunteer for Colorado Springs.
And Rosemary.
Hi, Rosemary Jaramillo with the Alzheimer's Association and the RAC committee.
And then Madam Chair, did you want to introduce Tracy?
Yes. Tracy, are you there?
Yes, I am.
Terrific. We appreciate your joining us today. Tracy is being with us today to see how we function and is considering joining us. And she will be having an interview this week, and we look forward to having her decide that she wants to join us.
Thank you. I appreciate being here.
We have agenda that we need to follow, and may I have approval for the agenda?
I so move.
Second.
Discussion?
Madam Chair, I would like to request an additional item be added to the agenda if we have time. We have some extra comments to share around the DEI possibilities as they relate to our area plan. So we will have, if we have time, I'd like to ask Melissa to share that information with us.
What does that acronym stand for?
Diversity, equity, and inclusion. So we will call for a vote.
All in favor, say aye.
Aye.
Raise your hand.
Aye.
Any negative? Thank you. We'll move forward then. Today's an important day in that we are approving or discussing and approving the 4-year plan that people have worked. I jumped ahead. We need to have a okay. We need to approve the minutes from last month's meeting. Thank you. A second?
I'll second. Debbie.
All in favor?
Aye.
Aye.
Thank you.
Madam Chair, on number 4 for public comments, we do have one request for public comment from Jason DeBueno from Silver Key. And Jason, you have 3 minutes. You're welcome to begin.
Thank you. I appreciate it. And thank you, Madam Chair and Jody, for the opportunity to present just briefly. Oh, a little pressure. I got a time clock in front of me.
Yeah, look at that.
What I wanted to share with this group is
Supreme
that
Court.
what I want to share with this group is that you may have heard some information about Silver Key needing to make a very difficult decision of moving forward with reducing our staff because of some challenges that we have with a potential contract cash flow issue that we have on a couple different fronts. And so with that, the decision that we had to make was related to administrative staff. This did not impact our direct service line staff. And I want to thank the TRS, the RAC, and PPACG and AAA for the funding that does come forward from the AAA and from other avenues of resource related to our transportation and the MMOF funding. All of these pieces and parts that come together help us to be able to achieve the great work that Silver Key does. And with that, we are committed to continue to serve at the level and quality that we have. What I had to do was reduce in our administrative area for the moment. And I wanted to just reassure the community, Silver Key is not going away. We are in a solid position. We were just, because these contracts did not get executed due to staffing challenges at the state and the federal level, in the time frame that we had anticipated, the drain on the cash position that we had become a red flag for the last 3 months, and we just could not continue in that same vein. The carryover support that we received from AAA allowed for us to continue our service delivery at the moment the way that we've had. And I know that B is in the room. One of the things that I want to reassure this community as well, and the other parts of our community, that the housing project that people have been invested in, either personally or professionally, thinking that we want to be able to have an extension of housing options, continues to be an option that we are moving forward with. We should be able to close that effort in May and start the groundbreak then, and that way we will continue to build the option for 50 units here in the community. So Silver Key is solid, and we had to make this decision to remain so. Their services stay the same and moving forward in quality care, and also the housing project continues. If there's any questions, I'd be glad to answer those, and I will pause with 30 seconds left. Thank you.
Thank you.
Thank you, Jason. Thank you for that update, and we wish you all the best in the continued services to the community. So thank you for sharing.
Okay. The important object of today is to review the 4-year plan that has been in process for a number of months and maybe a couple of years. And we will be doing that going forward. And Jen, would you like to? Jen is the chair of the Strategic Review Subcommittee. And she also has Debbie and B on her committee. But Jen, would you bring forward and discuss what you have presented?
So I think, thank you. Thank you, Marilyn. I think everyone has had an opportunity on the RAC to review the 4-year plan at this point. It should have gone out to you via email. Looks a lot like the document that's being shown on the screen. We've done a lot of discussion up front regarding the results of the CASOA. We've talked about how important it was for our community members to complete the CASOA, and have asked each of you to make sure that you're promoting around the people and friends and family that you know who may have gotten that report to complete the survey, and emphasize how extremely important it is for us as we're working on that plan, because we take that information extremely seriously. In addition to that, we've worked on a number of different community conversations that went into compiling this plan. And along with that, we want to present this plan today for approval. But first, I really want to recognize those who have worked so hard on that plan along with me. And it really would not be possible without the work that's been done by Melissa, Jody, and all of the team at Area Agency on Aging, Laura and Melody. They've really come together and done a lot of work at putting this plan together for us. As the SRS, we've been able to have the opportunity to review all of the results from the CASOA, the community conversations, and look at how that aligns with the work that we do on the RAC and the services that our providers give to our community members. It's been a very rewarding experience to see what we do in action. And I'm very grateful for that opportunity to serve the RAC in that capacity. So it's with extraordinary effort that the SRS is presenting this 4-year plan to the Regional Advisory Council for their approval. And I'd like to open it up for some input from the community providers, the RAC members. If you've got any sort of input or questions at this time, we're more than happy to answer those. But I think that if you look through there, the biggest piece to probably look through that highlights things would be that blueprint of action. I think it's important to know that this plan is really designed to be used as a working document. We kind of fleshed that out, I think, with our first time that we went through this in our SRS committee, is that it was important to us that this wasn't just a piece of paperwork and a document that is going to be sent off somewhere and put on a shelf. It was very important to us that it's something that we listen to our community, we listen to our providers, and we hold ourselves accountable. And it's very important for us that we even use the language within our document that we are going to be doing assessments. It's very important for us to look at, you know, are we serving our community? Are we honoring our providers and the programs? Are we making sure that we're responsible with our funding? How are we allocating that? And is it effective with our program operations? So are the community members, you know, are they satisfied with the services we provide? Does it align with what they've asked us to do? And that's really the point of our 4-year plan. And I hope that you see that as you've been able to read through that. That's pretty much it in a nutshell. Any questions or thoughts that you may have had as you've had a chance to read that?
Bill?
I'm just glad to see that Park County was only included in this change.
We are too, Bill.
Oh.
Bill is saying that he's glad to see that Park County is included. And we're glad to have him here representing Park County.
I sometimes feel like Calvin standing on the hill looking at the sky and says, I do exist.
Bill, you more than exist. You've attended so many of our SRS meetings, and you know, I was kind of saving it for the end, but honest to goodness, Bill would join us when he's in Texas. He'll join us when he's in Park County, and he'll turn off his video just so that he can join us, because he doesn't always necessarily have great internet connection, which was identified in our 4-year plan that we need to work on finding a better connection service for our rural community members. So Bill, I really appreciate your help and your input into this plan, along with Debbie Levin Stankiewicz. And I worked really hard to make sure I pronounce her name correctly. Her insight has been invaluable, along with B. Babbitt. B has just been a wealth of information and support for all of us on this committee. So yes, Bill, you exist, you more than exist, and you have incredible feedback. So thank you.
Madam Chair. Yeah, I want to echo a few key points. Jen, thank you so much for leading the charge on this year. Some of you may know that prior to coming on as a staff member here with the Area Agency on Aging, I had the opportunity to sit on the RAC for nearly 2.5 years leading up to my change in employment to become the director. And one of those projects was the previous 4-year plan, and I had the privilege of sitting on that committee with Jen and with B. and several others. And so it is how we've progressed from the last 4-year plan to the input to this 4-year plan is just astounding. The document really encompasses not just where we want to go moving forward, but this information that we were able to obtain through the community conversations. I shared at the last board meeting that the federal requirement for community conversations for each area agency on aging region across the US is 3 community conversations. We hosted 8. I'm really proud about that. And most of our RAC members attended at least one of those. Several attended more than one. And I think Bill, as we've mentioned before, probably gets the mileage award for attending so many of those. We so appreciate your input. And to be especially she took on the role as the moderator during those conversations. And I think when the elephant in the room is that I am not a senior. My staff several of my staff are not seniors, and I think the fact that RAC members who are older adults came with us be moderating the conversation. She was able to pick out pieces and ask follow-up questions that just came naturally. It just came naturally, and it made such an effective conversation, even before and during and sometimes after. We allocated 2 hours to each of these community conversations, and I know for sure that we went far beyond 2 hours in most of them because those conversations were so good. We gleaned a lot of information from those. And so the other part of that is that in addition to the, I believe, 13 SRS meetings, there were an additional 11 meetings that encompassed the SRS committee, along with key members of the community and key staff members for specific program areas. And all of that to say that there was an enormous amount of time and commitment added to the report this year. And to Jen's point, yes, this is not a document that we finish and put on a shelf and, get a nice cover for and distribute and, we're done, wipe our hands and move on. This is a living tool. Not only is it due to the state at the end of March, the state then uses our report along with 15 of the other Colorado Area Agency on Aging reports to develop their own, which ultimately is used as part of the funding conversations at the state level. We're very pleased to share that the state of Colorado, and specifically the funding support that we receive from the state, is generally much higher on average than most other states. We receive generally about 55% of our funding from the state, with about 45% coming from the federal government. And so we're very pleased to be able to, even though this is a mandate, we are required to do this. It is a true tool that is effective, and it is used in the process that it's intended for. And internally, again, we don't put this on a shelf. We don't pat ourselves on the back and move on. I will pat every one of you on the back. It has been an incredible work that's been done. But ultimately, this feeds into our Pikes Peak Area Council of Governments strategic planning process, our work plans every year. We pull out key pieces of information that we can use as we move forward, and ultimately determining our funding decisions as well as our work plan decisions with our parent agency, the Council of Governments. And so again, kudos to Jen and the SRS team for putting this together. Members of our staff here that have already been mentioned, Melissa, Melody, and Laura, there were whole key key roles in putting this together, but also almost every member of our staff, I believe, correct me if I'm wrong, but I think every member of the AAA staff also engaged through those conversations, because ultimately what are we doing? We're asking them to also make sure that the work that's being done flows correctly through those departments as well. One other area that's very important to understand that the the area plan is also part of the expectations of all future providers to ensure that they're familiar with the area plan so that they can show how their funding will coordinate with the area plan. And so once this is released and made public, after it's approved, it won't be immediately March 31st, but once we receive approval from the state that it's been accepted and is approved, we will then release this to all of our current providers, and we will direct future providers to this on our website so that they can be familiar with the expectations that their funding will engage with. So just wanted to share a few of those things. And thank you very much again, Jen and B and Debbie and Bill and so many others that engaged in this process. I think it's far more work and far more boy. You know, I think when we were on the committee 4 years ago, we were kind of proofers. I think that's fair to say. We were proofers. And Melissa, as a fairly new staff member with the AAA, was a great guide to that process. But I am just so thrilled with the engagement of our staff, the engagement of our RAC members, and specifically the SRS subcommittee this time around. Thank you for all of your work. We appreciate you.
Is there any further discussion?
Hey, can I make a comment? This is Kathy Lowry from Teller Senior Coalition.
Certainly.
I was surprised to see that nutrition was not an area of focus. And one, I was curious, does that mean that we've actually done a pretty good job of making sure seniors have enough food to eat? And then two, I guess I'm a little bit concerned, you know, that's one of the missions that we have that's near and dear to my heart. And I want to make sure that if we've done a good job making sure seniors have enough food, that won't be negatively impacted with these changes in the focus areas. So that's my thought.
Yeah, thank you so much. Yeah, I think that's something to consider. You know, there are some areas that are considered focus areas because they have not, you know, there are challenges in those areas, whether by funding or providers or just accessible services. Even though it may not be part of a highlighted area, does not mean it's still important. Kathy, you're on the right track that our meal programs are probably the strongest of many of our programs. And so thank you for the work that you all do. And since Silver Key, I think Jason is still on, you know, the Silver Key programs are so crucial to our region. And folks in Park County, you know, have created some additional programs already around serving the meal needs of their clients by adding their freezer projects. So right. It'll never go away, but in the next 4 years, it does not need to rise to the highest level. There are other areas that we'll be focusing some extra time on, but it doesn't go away.
Yeah. Our problem is getting word out to the people that it's available.
Right. And that was part of the conversations and part of the report is ensuring that we can share that information and find other ways to share that information out to the residents. You know, we heard that, of course, in the community conversations. You know, I don't know about these services. Well, you know, that's exactly what we need to hear, because that's what we can also communicate to the state. So, yeah, thank you very much.
Thank you. Is there any further discussion?
Let's see. So along those lines, I think that the report is impressive. A lot of work's been done, and it's a very impressive document. It does call out the need for getting the word out. And I'm curious what the feeling is about dealing with the state and federal restrictions on advertising. And
Yeah.
I didn't see that referenced here except in one little place. And I didn't see what the workaround was.
Yeah,
Is that a challenge for us?
It is a continued challenge. You're spot on there, Jim. No surprises there. I see Jen shaking her head, and staff in the room here just fit to be tied most days when someone hears, that we're the best kept secret. Well, that's not a good thing, and that's going to make me pull the rest of my hair out, but we are working with the state to figure out some additional ways. And this is not just a Region 4 issue. This is national, because these are federal regulations that we're required to follow. And so we are currently working with the state. In fact, this week, I'm not sure I've shared this with all of my staff that are sitting in the room, so I apologize. It's been a doozy of a week, but we've received some state guidance that we can do that we can use some of our admin funding, which is not allowed to be used in any other fashion. We can use some of our admin funding for some of our some additional outreach that we're not allowed to use right now. And that's primarily thinking about health fairs and senior expos and that kind of thing. In the past, we've had to kind of hope and a prayer if folks would either provide a trade with us, or, for example, in our yellow book, or perhaps we had some unrestricted funding donations come in that we were able to access to pay for those. Now the state is going to allow us to use those as part of our outreach funds. That is something that's very new. Literally got the final word, I think it was either late Tuesday or yesterday morning, about that. So that's exciting, because if there's a health fair going on in town, or a senior expo up in Teller County, it just makes sense that the Area Agency on Aging is present at as many of those as possible, because that's bringing in large groups of folks, materials with our name on it, that kind of thing get distributed. And so I call that a very successful but very first step to that process. The state is working with conversations across the ACL, the Administration on Community Living, discussions. They ultimately interpret the federal rules as it relates to older adult services. And so those conversations are ongoing. We are being heard at across the state and across the federal processes. But right now, technically, it is very difficult to purchase media, purchase ads in the newspaper, that kind of thing. It's very cumbersome. And if we can get it approved, you really wonder, was it worth the time and the expense. And so there's a lot of steps yet to go. But thank you. That is something that we heard in conjunction with what Bill mentioned. People don't know about the Area Agencies on Aging, except when any of us goes to a meeting, we say every county is covered by an Area Agency on Aging, but yet we have this rule over us that doesn't let me tell you that. And from my perspective, that's a hindrance to the work that we could be doing. So I think there's a lot of missed opportunities that I think are going to be rectified, especially as we continue to move through the 21st century and what communication needs to look like, and what outreach needs to look like. Debbie, I think I saw your hand waved there.
Yes, you did. I know you've also begun to ask all of us volunteers what other organizations that we're involved in besides the area agency, and how we can connect all those other organizations that we attend meetings or whatever, so that they can get to learn more about the local area agency. So
Yeah.
that's another way of expanding people's knowledge.
Yes, thank you. Thank you.
Yeah.
And also,
Probably illegal, but I've been advertising to the 4 churches in the Lake George area.
You can advertise all you want, Mr. Bill. I just can't pay for it right now. So talk us up, Jen.
yeah, I just want to add that, one of the things that in the plan, it's in page 21 and 22. It's a kind of unique word that we had to wrap our heads around, but it was called targeting is more of the word that we had to be used, that we were using for outreach in the plan. And one of the things that we discovered, we had a very robust discussion about this, is that we didn't want to limit ourselves in specific processes for this particular type of outreach, which is why we kind of left this very broad in nature. We were anticipating and hopeful that Jody might get some sort of news on some alternative options for us. So Jim, I really appreciate that question. But we had a very lengthy discussion about that. And there are a lot of ideas that were generated as a result of that discussion. And we're hopeful to see that as we do those midpoint assessments, that we're reviewing how we are being successful with that outreach. So I'm really glad that you brought that up, because it is extremely important. We've identified that with those community discussions, that people aren't aware of our services. It is a big need, and we have to be careful of how we do it so that we meet the guidelines. But yeah, thank you so much.
Yeah, thank you. Since Mary said that she had to jump up and leave every so often, she does have a note in the chat. Jared, would you mind reading that for us?
I'm happy to, Mary. I don't know if you wanted to say it, but I'm happy to read it off.
This might be.
All right. Yeah, that might be one of these times. That's fine. So Mary
Okay.
had a
No, I was unmuted.
sorry.
Yes, please go ahead and read those questions. If it fits in with Jean's time, I just was thinking if I could get it written down, I wouldn't forget to tell you.
No, that works. And I think it does apply to the topic at hand. So what Mary wrote in the chat, many cities now, including Fountain, have no local newspaper, but we are told to use the community website. Are we able to supply a monthly newsletter to all of our little communities for inclusion on their websites? And then she also put in, can we have digital copies of such a newsletter so we can share with our churches, not just pinpointed info, but some general who we are information?
Yeah, those are great questions. So yes, if there's anything already in a digital format, especially if it's already on our website, you are most welcome to pick that up and share it, whether by sending a link or printing out a piece, something like that. If there are occasions where something's electronic and you think the target audience would be better served with printed materials, it's just a phone call here to the office. We will make sure that printed materials are made available for you to pick up and share out. We'd be very happy to do that. Where we're talking, sometimes when we're talking about actual paid media, it is complicated, and there are a variety of community community websites or community bulletin boards. If you are aware of that, I would encourage you to send that link here to Melissa. And then ultimately Jared, who you hear by voice here in the room, Jared is actually our public information officer for the Area Council of Governments. And so we love that Jared is here with us. He's a pro at making sure that we're getting the word out through those appropriate channels. But if we're not familiar with the channels, we're not aware of the channels, then it's not by lack of desire, it's just not knowing that it's there and available. And so if you are aware of a channel like that, please get that to us and we'll make sure that that gets on our regular round of information. Of course, some of our more public facing events are Social Security classes, our Medicare 101s, our para classes, that kind of thing. But if we're aware of a community calendar, we can put so much more there if we're going to be out in a neighborhood or out at an expo or a senior health fair, something like that. It
Could you
certainly
please
becomes a tool to us.
Could you put Jared's address on the chat?
Jared, do you want those coming directly to you or to Melissa? Okay, I would like those to actually go through Melissa so she can coordinate those with Jared, so we don't bombard Jared. So if you'll send them to mmarts, MMARTS at ppacg.org, that would be the best way to do it. Then she and Jared can coordinate accordingly.
Got it. Thank you. Jean, thank you for the time to do that.
So a couple of things, just kind of what's next and, you know, what happens after today. You all are recommending approval by the PPACG Board of Directors to ultimately for this document to be turned into the state as our final product. What we can do though is we have to provide updates on this information in a very quick turnaround. So if you found typos, if you found language that needs to be changed, that kind of thing, please forward those to Melissa as soon as possible. We're not going to go through those today, but if you caught something that we did not, I know Melissa's tired of getting the emails from me, but I've almost worn out my proverbial red pen. Just the read throughs and, this awesome work. I know B mentioned a couple of things that we need to get corrected as well. If you would send those directly to Melissa, she and Jared will finalize this last piece. This will go to the Board of Directors on March 8th. Which means that we have to submit it to them the week before. And so we have to finalize things fairly quickly. So I would ask that you submit these, anything like this, by noon tomorrow. Okay? So that gives you a deadline and that gives us a working deadline so that we can turn around and get updates to that. Updated. I did also want to make note, several years ago, Melissa worked with a fantastic professional photographer and made arrangements for some great work. And we're going to update our the cover photos of the area plan with these local folks. Okay, so the stock photos are gorgeous. Jared again has been instrumental in actually putting this entire layout together. And so he and Melissa have been working on this, but we're going to lift these stock photos off of the front page. They're lovely people, but they're not here. They're not us. And so we're going to take advantage of the awesome work that Melissa coordinated several years ago and get our local folks on the cover of our area plan. So I'm really excited that we have those photos we can access. Once this goes to our Board of Directors, if they receive this here in the next couple of weeks at their meeting, we will have a document that just simply shows that they're receiving this and submitting it to the state. There will be a signature line. Marilyn, I'll have a signature line for you, so we'll coordinate to have you sign in your spot, and we'll have the board chair, who is Mayor Sharon Thompson right now of the Pikes Peak Area Council of Governments. She's the chair, and we'll have a line for her to sign as well. And then we will put the final pieces, final touches on this and get this to the state, I believe, well in advance of our March 31st deadline. So again, I cannot express it enough. Just the thanks of our staff, of Jen and the SRS committee, and every one of you that participated in this project. I am so proud of what we're about to submit to the state. So thank you very much. Call for order, or a call for a motion to receive it with adjustments.
I'd like to call for order and a motion to receive it.
So moved.
I have a second.
I'll second.
Thank you.
Any final discussion?
Any final discussion? Thank you all for your comments. The motion is passed.
We have to ask for.
I didn't vote.
We're learning, ladies and gentlemen.
To ask for a vote.
I'm asking for a vote. All those in favor?
Aye.
Aye.
Aye. Need a
Aye.
hand or what?
Opposed, like sign.
Any opposed? Thank you. The motion is passed. Did it right that time?
Okay. Do we have? Roma's here. Okay,
Yes, she
good.
is.
Sorry, I can't see you.
She's behind the column. Yes.
So we'll do 6A, excuse me, we'll do 6A presentation of the SHIP program. And then we will insert there as 6F. Melissa, does that sound good, Melissa? Okay. All right. Roma,
Thank you,
you're up.
Rama. Would you?
Just right there. We'll pause for a moment. Jared is getting Roma's presentation set up.
All right. So good morning, everyone. My name is Roma. I am the coordinator for the local SHIP program. And today I'm going to explain what that means and what that is. So obviously I'm with the Area Agency on Aging. And you guys are fully aware of what that is. So the SHIP program stands for State Insurance or State Health Insurance Program, or SHIP, which is a federally funded program that's designed specifically to provide free, unbiased education and information and assistance on all things Medicare and all things related to Medicare. So the mission of the SHIP is to empower, educate, and assist. And our vision is to be known as a trusted or the trusted source for Medicare information. Every county in every state and territory has a SHIP program. This is a federally funded nationwide program. It's managed by the Administration for Community Living. So again, there are 54 SHIP grantees, every state, every territory. The grants that are given to the states and territories are managed either through the state's units on aging or departments of insurance. And then that money is sub-granted to smaller entities on the local level, which are either through AAAs or Department of Human Services, other types of partnerships, or they could be independent nonprofits, which is how this SHIP started when it was first created in 1998, I think. Nationally, there are over 2,200 SHIP programs with over 12,000 team members. This particular SHIP office is responsible for a total of 3 grants that are basically SHIP grants. So we have the State Health Insurance Assistance Program. We also have a grant for the sister program, which is the Senior Medicare Patrol. And we have a 3rd grant for MIPA, or Medicare Improvement for Patients and Providers Act, which is a program that helps people who have limited or low incomes with financial assistance programs. So services that the SHIP provides. Our primary function typically is going to be insurance counseling. That's counseling on all parts of Medicare, enrollment, eligibility, costs, benefits, as well as the types of insurance that are available to go with Medicare, including Medigap Advantage plans, the newest benefit of Medicare for Part D drug coverage. We also can counsel and educate and assist with long-term care insurance, both policy review and claims. We can talk to people about their employer plans, retirement benefits, COBRA. When I first started doing this work 20 plus years ago, claims assistance was probably the biggest service that we provided regarding people who needed help submitting some claims to some of their Medicare related insurances. We also help with appeals and denials. These days, our primary focus is on outreach and education, and we offer that service through a variety of methods. Primarily, we do presentations. So I do a Medicare 101 comprehensive presentation, which is a 4-week, 4-part program that I do every other month. We also attend any fairs and events that we can get ourselves into. We started doing podcasts last year, which I think have been pretty effective. And any other means of outreach that we can participate in. We are always looking for opportunities to get the word out about what we do and why we do it. Under the MIPA grant, we also do screening and application assistance, again, for people who have limited or low incomes, to help them apply for financial assistance programs that will help with the costs of their Medicare, both the medical and the prescription part. We can also do screening and application assistance for regular Medicaid programs, such as the long-term care, old age pension, and we help people with their annual redeterminations through the Medicaid programs. The sister program for SHIP, the Senior Medicare Patrol, is a separate program that is specifically designed to help educate and assist beneficiaries with fraud, Medicare and Medicaid fraud and abuse. So the motto of that program is protect, detect, report. So we educate beneficiaries on how to identify potential fraud and abuse, what to do if they believe that they are encountering fraud and abuse, and we help either investigate and or report that to both the state and federal levels. Outreach for this is also done in the form of presentations, podcasts, attending fairs and events. But when we assist clients, when we assist beneficiaries, primarily what we run into is billing errors versus actual fraud or marketing issues for the different types of insurance products that are available. More information about both these programs. So for the SMP program, there's a national website, smpresource.org, which has great information and can help people locate the SMP program closest to where they are at anywhere in the country. And there is a Colorado toll-free number if anybody needs to report potential fraud or abuse. As with all government-funded programs, We are a not-for-profit, so we are always looking for volunteers to assist us in our mission. I can tell you that the volunteers that we have had in the past and the volunteers that we have now find volunteering for both SHIP or SMP programs to be very fulfilling, challenging. You know, there's a lot to learn, but it's also very rewarding to be able to assist people with such complicated programs and concerns. We do have a toll-free number here in Colorado. If someone calls that toll-free number anywhere in the state of Colorado, it will route them to the SHIP office closest to where they're calling from. There are a total of 13 SHIP offices in Colorado. This particular office covers a lot of counties as well. There's also a national website for SHIP, shiptacenter.org, that can provide a lot of good information, can help someone locate the SHIP office wherever they are at, and has some information about volunteer opportunities as well. This SHIP office here out of the Area Agency on Aging actually covers a total of 9 counties in Colorado. So we don't just cover the 3-county region for the AAA. We have an additional 6 counties that we are responsible to provide information and education in. A lot of them are very rural. But again, if you call our statewide toll-free number from anywhere in the state, it will route you to the program closest to where you're calling from or that's responsible for the county that you live in. Again, I am the coordinator for the program out of the Area Agency on Aging, so I am responsible for making sure that services are provided in all of those counties. I am also under contract with the Division of Insurance in Colorado to be the subject matter expert for all SHIP counselors in Colorado, as well as a counselor trainer here in Colorado. And I think that's all I have for you.
Do we have any questions?
Would it be possible to?
I will put it in the
that-
chat. I will.
What?
Go ahead, Jim.
I was just asking if it was possible to get an electronic version of these view graphs.
The PowerPoint?
Or
Sure, absolutely.
link to them or something.
Yes, we can get that to you, Jim.
Thank you.
Anyone else?
Yeah,
Pete?
I second that.
Roma, during COVID, you provided a lot of service via phone or online. How is that changing now? Are you seeing more people in person?
We are definitely seeing more people in person now that we have the ability to do so. Because this can be a very complicated topic to help people with, and everybody's situation is unique. In person, counseling is always or typically preferred, but we are still able to offer both online via video conference like Zoom or Teams counseling and telephone counseling. So that hasn't changed at all, but we do see a lot more people in person because that's typically a preference.
And I
Go ahead.
have a question also. I'm sure everyone here has seen all the television ads about Medicare Advantage.
Yes.
And personally, I don't consider Medicare Advantage to be Medicare. It's private insurance. And I'm just wondering whether there's any kind of advocacy. I mean, I know that you're not allowed to advertise the way Medicare Advantage is, which I think is a disadvantage. And I'm just wondering whether there's any kind of advocacy going on the federal level or the state level to try to make that people more aware of that.
So yeah, that's actually a really good question. So obviously everybody has seen those commercials on TV. They were pretty prevalent in the last couple of years, especially during the open enrollment period, but they run year round. Unfortunately, you know, the last 5 or 6 years saw some deregulation on how those types of insurances could be marketed. And the result of that is now at the federal level, there is concern about those marketing practices. So it is actually a conversation that they're having at the federal level about how these types of insurances are being marketed and what the companies that are marketing them are allowed to do and not do. This is something that we're all very aware of. It's something that we're all paying a lot of attention to. And I'm actually reporting anything that we are coming across that might be problematic or concerning to the Division of Insurance office on a monthly basis, because they're reporting it to the federal offices on a monthly basis as well. So at a federal level, it is being looked at pretty closely right now on a regular basis. And you're right, there's a huge advantage for these insurance companies to have the monies to be able to market their products, whereas, you know, we do not. It's hard for us to even get the word out, as Jody was talking about earlier. People don't know what they don't know, and, you know, they don't know about what we do until they need us to help them with something after it's already gone wrong.
And they
So-
certainly don't understand the differences about, you know, in terms of having Medicare Advantage, and it's growing. Medicare Advantage is growing every
It
year.
is, it is.
And
And you're right, it is insurance offered by private insurance companies, which even though they have to offer all Medicare covered services, they still have a lot more control over those services and how people receive them than, you know, if they didn't have that kind of coverage. So, you know, it's an option for people. It's, you know, options are a good thing to have. But I think sometimes there's a lot of misinformation and a lot of misunderstanding about how those options work. And that's really where people end up being unhappy or unsatisfied sometimes when they pick those options. So we spend a lot of time educating people about those different kinds of insurances to make sure that they are making informed decisions with their coverage.
During COVID too, I want to share, Roma, during COVID, because so many people were at home, they were probably seeing those ads far more often than maybe on an average day. But specifically around open enrollment, we did several, in fact, primarily during 20 and 21, we did direct mail postcards to folks who were already registered within Area Agency on Aging systems. And so El Paso County, as well as the other 8 counties, received mailings to encourage them to get the facts directly from their local SHIP office. And so we do have the privilege of those additional 6 counties outside of our primary 3 fall nice and neat within 2 other AAA office regions. And so we're able to work with those AAA directors and staff members to get the word out, whether that's through printed media, like the postcards that we did for those 2 years open enrollment, but also special events, working with their own libraries and other agencies. Department of Human Services have been a big part of outreach in the last couple of years as well. And so just like the conversation earlier where we're talking, you know, Jim raised about the ability to purchase media, there are restrictions because these are federal funds. I will share, though, that there's some additional funds that have come in from 2020 through the SHIP process, so effectively coming through the Division of Insurance, where they are dropping that regulation specifically for these funds. And so internally, we actually have a second meeting this afternoon to talk about how we can use those funds to get the word out about the SHIP program to the greater community. And so, you know, I like to point out that yes, that regulation is there, But we push and we nudge and we ask questions. And, you know, we are entrusted not just with these public dollars to do the work, but we are also entrusted with the mandate that comes with that to get services out to the community. And our perspective on that is that there's a crossroads there where we have to ask the feds to make some changes so that we can do it better and broader across our region. And so Jim and others from the RAC know that we aren't afraid to push the envelope, and we aren't afraid to ask the questions over and over again and share the need and figure out best ways to get the word out there. So we're really excited. We have about 30 days. We have to spend these funds by the end of March, but there's a specific allowance that allows us to purchase some media. And so with our fantastic newer staff member here, Jared, as PIO, he's going to help us make that happen. So we're really excited about that opportunity. And again, as I said earlier, these conversations are happening not just here within, within the Area Agency on Aging here, but we have those conversations with the Colorado Association of AAAs, who in turn, we have these conversations with the state. And the states are having these conversations at the federal level. So we're hoping that there'll be an ease up in some of these regulations at some point, but it is a work in process, and we do find opportunities and take advantage of opportunities to allow us to get the word out bigger and broader than we normally can. So, and I will share, Roma is our guru. As she mentioned earlier, she kind of skimmed over it, but she is she's the guru for state of Colorado Division of Insurance around the SHIP programs, and one of the primary trainers of the SHIP program. So we're very fortunate to have her here in the office, working with us here across these 9 counties. Jim, you had another question?
It's not really a question, it's a comment. Where you get the opportunity to make some inroads into this restriction. Of course, it's super important that you're proud of what you've done and can report progress and the data that said it was effective. Otherwise, you just reinforce the regulators' desire to regulate. If they find abuses or ineffective programs, they go, look at that.
Yeah, thank you very much for pointing that out. And we're really excited that even during our annual assessment process, as you know, as RAC members, all of our providers go through program and fiscal assessments. Well, the AAA also goes through assessments with the state, and that is something that through some of our documentation that we're required to provide, that we can show what we did with those funds. We can show how we did it, the results of those actions. And so, yes, there is a kind of a full circle opportunity there where we can show that information. So thank you. That is crucial, obviously, that we can show that that is happening. So thank you. Let's see, was there another chat, Jared?
There was. Mary, I don't know if you wanted to ask that question, otherwise I'm happy to read it from the chat. Oh,
Just go ahead and read it.
okay. So Mary's question, are we doing presentations about SHIP at county fairs?
So typically when we attend like county fairs, we man a booth and have a large variety of information available for people to come by and pick up. And that gives us an opportunity to engage with people who attend those events. But typically it's not going to be a situation where we're providing an actual presentation unless we're invited to. Certainly whenever we have the ability and the opportunity to do a presentation, even at like a fair or an expo, we absolutely take advantage of that. But usually at fairs, it's manning a booth and just engaging with the public about what we do and providing some handouts and stuff.
I would say that generally speaking, we say yes, and then we figured out the details later. If we
Are
have,
these-
if we
these-
have opportunity to get into a health fair or a senior expo or the county fair situation, we do that. If we're invited to something, we say yes, and we figure out how that's going to look after. Our goal really is to make sure that we are taking advantage of every opportunity like that.
Are these opportunities where the volunteers are needed?
They can be.
Absolutely,
Absolutely, absolutely. Yeah. As we sort those out, sometimes there are opportunities where we can engage either RAC members or our information and assistance volunteers, sometimes our Medicare volunteers. It just depends on the circumstance and the intention of the outreach. But yes, we have and we will continue to call on volunteers to help support us in that way. Thank you.
Any further questions? Thank you, Roma. That was I learned a lot. I did not know you did all of the Medicare as well. So
Thank you.
Thank you for that careful explanation.
Well, thank you. I appreciate your time and your attention, and I'm certainly available if anybody has other questions afterwards.
Okay. We'll move on to item B, a membership committee. That's Rosemary. Rosemary, do you have any report? Oh, yeah.
Hi there. Yeah, it actually has been very quiet. We did send out a birthday card this month. And then do appreciate the introduction of Tracy, and actually our Fountain Mayor Thompson, City of Fountain, introduced her to us via email. So we're happy that she's here today, and hopefully she finds this in her wheelhouse. So, but that's all we have really. So thanks.
Thank you. Jen, on the Strategic Review Committee, you've pretty well covered what's been taking place, and we're most grateful for all of the work you and your committee have done. And it's, for me personally, it's the thing that you've said the most that entices me is the fact it's a living document. It's a living document where we will make changes as things come up. And having worked in the federal government, most of the policy procedures that I've ever been involved in go on the shelf. And so thank you very much, all of you on that committee, and the staff is part of that. Jody, do you have anything additional?
Thank you, Madam Chair. I do have a couple of things I'll share. A lot of what I was going to share, we've talked about a little bit as it relates to the 4-year plan and the process. And so again, reiterating our gratitude for the level of involvement from the Regional Advisory Council and staff this year in helping with the 4-year plan. I will say that I get calls all the time from other AAAs, not just in Colorado, but other parts of the nation where they've heard about our RAC. So you are known and you are doing a fantastic job with your involvement. And that I love to brag on you when we're at state meetings and at national meetings because this group truly meets not just the mandates of having a RAC. It's part of the Older Americans Act. We have to have this citizen input through a regional advisory council. But I'm finding more and more that AAAs sometimes have a regional advisory council, but they're somewhat ineffective. They come to the meeting once a month and that's it. They vote on what they're supposed to vote on and that's it. They don't engage with their area agency on aging. They're not involved with the area agency on aging. I think one of the last times I was sharing, I was talking about all the subcommittees, membership and TRS and SRS. And I was I could see on people's faces around the room where they were like, tell us more. How do you make this work? And I say, it's not me. It's, Melissa doesn't, it's not us, it's you all. It's you all who have taken the time and are committed to supporting the Area Agency on Aging and ultimately the work that's being done by so many of our providers across the region. And so your engagement and your involvement in the process is crucial to what we do. And I can thank you all day long, and I am very happy to do so, but I want you to hear that there are other agencies that aren't as lucky as we are here at the Pikes Peak Area Agency on Aging. So I wanted you to hear that from me as I share these in our state and national meetings. So again, good job with the 4-year plan. One other area that's not as regular is the legislative and policy side of the work that we do with the Area Agency on Aging. The RAC, as you know, you are primarily tasked to assist with the 4-year plan and with the funding distribution, thereby the SRS and the TRS subcommittees. Okay. And so, however, one other AAA committee that we have is called the Pikes Peak Council Commission on Aging. And they were previously housed under the city, and so is Colorado Springs Commission on Aging. It came out of the age-friendly process several years ago. And in 2021, is that right? 2021, working with the city, we moved that commission to fall within the Pikes Peak Area Council of Governments, and specifically the Pikes Peak Area Agency on Aging, to represent a regional view around policy and legislation. Our Pikes Peak Area Council of Governments also, the board of directors has a legislative subcommittee. And so we look at those greater policy and legislative issues, both across the state and sometimes even at the national level. As some of you may recall, last year around this time, I had the privilege of testifying in support of the homestead tax exemption expansion. And that expansion was primarily around portability for seniors to carry their tax exemption if they chose to downsize, for example, as well as an expansion of the actual eligibility of the dollar amount as it related to that property tax. It was voted down, and so it died in committee. However, this year it came back with some rewrites and moved very quickly before committee. And I am just tickled to share that B and I both had the opportunity from our region to testify for it. It did die in committee temporarily again this time. Apparently there was a procedural issue that it was voted down, but our understanding is it's not about the content and it's not about the intention of the bill. And so that bill should be coming back before committee at some time during this legislative session. And so I will be calling on B again to help testify with that. So just wanted to share that, last year there were a lot of proponents, a lot of positive testimony for that bill to be changed as it relates to the homestead tax or the property tax exemption. But as I listened to the testimony online, I was there in person seeing who was in the room. I knew quite a few of the folks from my, the plethora of senior service advocates that I know across the state. But there was not a single senior to testify for the bill. This year, we had the privilege of having B along with one other lady from, I believe, the Denver metro area who was there to testify as well. So just wanted to share that that's a little bit out of the normal wheelhouse for the Regional Advisory Council, but I know B had been watching it and had been engaged in conversation last year. And so we invited her along with a variety of other folks, but B and I were it from this time. So thank you, B. I'm not sure I got to say that to you, but thank you for taking that 2 minutes out of your day. We get 2 minutes testifying. So Jason, we gave you 3. So, but it was just really, really neat to be able to engage in that process and know that it wasn't around the content of the bill for it being denied this time, but that it will come around again once they have those procedural issues sorted out. So for me, there's a variety of meetings coming up. Specifically, we have our regular quarterly provider meeting coming up. It's scheduled for April 19th. Providers have already gotten that invitation. Regional advisory councils, we invite you to that meeting as well. It's a great opportunity to hear from us as staff as we talk to our providers. And so we'd invite you to attend those as well. You're not required to, and it's really not an expectation. This is just an invitation from us if you have time so that you can hear updates from us. It's also an opportunity for our providers to learn a little bit more about each other and where there might be opportunities for collaboration across the region or across the street, for that matter, since we have so many here in the El Paso County area. But we started this last year. It was one of our work plan goals that we set with our board and strategic planning. And so April, do I have that date right? April 19th? Yes, thank you. April 19th is our next one. We talk about funding, we talk about services. It's a good opportunity for the providers to share as well, especially if they're looking for any help or looking for ideas. It's just a good opportunity for collaboration. And as you know, I love the C word, collaboration. So aside from that, I think I will go ahead and pass it on to Madam Chair. Thank you very much.
Thank you, Jody. As I've listened to her today on everything that's been planned and accomplished, I think that the thing that I can focus on is getting the word out. Because now, as far as what Roma said and being with SHIP, the people that I know, they know about SHIP, but they don't know about us. And keep that in mind as we're making arrangements to tell people and who we might be speaking in front of. And the need for volunteers. Because we're volunteers too, but we need a whole staff of volunteers that can be helping to create the environment that we have put on this paper. And the caregiving one as well. I don't know that much about the caregiving, but I'm looking forward to learning more and attending the meeting so I can be up to date. And I like that what Jared was giving the information on today about the housing resources and how much Silver Key has progressed in making that a reality. And as Roma taught us today, preparing for retirement and addressing the Medicare and Medicaid needs. There were things that I was not aware of. I knew they did Medicaid and Medicare, but I didn't realize it went into the retirement so much. So there's always something for us to learn. And that's what's beautiful about attending these meetings and being part of it, because together we make a whole. And I guess that's word synergy. And I want you to know that you are all appreciated, and all of the work that's gone into creating this document. It's absolutely terrific. It's not even that word isn't even strong enough, because as Jody was saying, that this particular area really believes in what we're doing, and we believe in what we're doing, and that makes a difference. Because I have been in contact with other areas, not intentionally, but the subject has come up and they have no clue what I'm talking about, because that's what they do. And it was what I did for the first few times that I came, which was 8 years ago. And right now I can see so much difference from 8 years ago and what we're doing today, and how large we've become. And the most thing is we really are offering services much greater than we were able to do 8 years ago. So that would be my comment today. Is there any other discussion? What are we going to do about having the other demonstration?
We're actually going to have, so Melissa, the person who would normally give that presentation is on vacation. And so she
Okay.
shared some information with Melissa. So Melissa's going to
Good, we
share
have
with us
time.
today. Yes, I think we do. Oh, yes. And just as a precursor, while Jared and Melissa are getting the PowerPoint set up, in beginning of 2022, President Biden put together a special action plan around expanding diversity, equity, and inclusion across all aspects of work that is to be done. And so there's been a process of, again, just like some of our other areas of focus, some interpretation and directives from the state. That's why you see that language and some of the intentions that we would like to do across the next 4 years, because these are now new items within our policies and procedures. And frankly, it's the right thing to do, right? So sometimes it doesn't need to be a policy for us to know that these are things that we need to make sure that we're doing across our region as we seek out services and the work that we do here in the office. So Melissa, please feel free to jump in and.
All right. Well, thanks, Jody. And again, as Jody mentioned, Jennifer Horn, one of our staff in the family caregiver program, she would have been here today presenting, but she can't. And we thought the executive committee with the RAC wanted to take a moment during Black History Month, because that's what this month is of February, to, just kind of have a chance to talk a little bit about equity and some of the strategies and tools that are out there that we as an organization can be looking at, the RAC can be looking at, and kind of see where we go from here. Jennifer has also been participating in a fellowship program through the American Association for Aging. And when she did that, she has put together some really unique tools. And so one of them is this equity assessment checklist that we're going to take a few minutes to look at this point. So go ahead, Jared. And so as we kind of take a peek and move through the couple of screens that we have, a checklist gives us an opportunity to kind of look at things that we might be doing, things that we might be able to do better, as well as things that we're not doing at all because we didn't know what we didn't know. And so having an opportunity to dig a little deeper and do our outreach differently, and also have materials available for folks that we might not have had available in the past. And again, as we think about, go ahead to the next screen, Jared, that'd be great. as we think about, the communities that we want to be considering and taking a little deeper dive into, we think about this concept of communities of greatest social need. And you can kind of see the list of folks that we want to be looking for and reaching out to those communities. Over the last year, and I guess it was even prior to that, again, our Regional Advisory Council was taking a concerted effort to reach out to these underrepresented groups of individuals. And we had Cynthia Aki on our rack, and she had brought it to our attention that it might be interesting to try to do a heritage food bag distribution in order to start to break out and get more connected with some of these communities. And so we've done that and made some inroads with the Black, the Latino, the Native American, and the Asian the Asian communities in our region. And then also through that, again, Jennifer in our family caregiver giving program, along with Kent, they are going to be branching out and doing more with their family caregiver program and looking to create kind of a volunteer ambassador program in different communities so that we can raise more awareness around family caregiving services, as well as just all of the area agency on aging work that we do. So, when we talk about this equity assessment checklist, we're thinking about these particular communities of people in our region, all 3 counties. Go ahead, Jared. And so one of the first pieces is when we put together materials that we have to share with the community and to do outreach, do we kind of represent these different communities? Do we have images, pictures of people? And it really does take an effort to find these pieces of information. It's not something that's just always right in front of us. As we get better at doing it, we will find that we have a lot more available. But in the beginning, we really do have to look and really do make a concerted effort to say, do we have the right kind of imagery? Do we have language that we're using that's inclusive? And it does take practice, and it does take a conscious effort to do that. We also want to know that our staff and volunteers, kind of represent the different populations of people as well, and that our staff and volunteers are knowledgeable about these different issues that are out there and can be speaking proactively about it too. Next one. And so then we also look at, policies and practices that we have. And so are there opportunities to, again, use different types of language, different types of images in the policies and procedures that we have? Again, I think one of the pieces that made it into the 4-year plan has to do with how are we continuing to support our staff and volunteers, as well as taking an opportunity to work with our contracted providers in the community, that we're all, embracing, different language, that we are inclusive, and we're thinking consciously about how we're doing outreach to reach these populations. So next. And then data collection is also interesting. When we did the 4-year plan, we actually found that the state gave us some resources specifically to go to gather more information around these populations. And so we did outreach there and look to gather more information. But then as we actually try to collect data ourselves too, we have to be conscious of the types of words we're using, the imagery that we're using, and are we being respectful of the folks that we're reaching out to? And again, this is just something that, we'll need to be more conscious of what the practices that we're doing. And fortunately, we have some staff that have been hired in the last, couple of years that are really helpful with this as well. And so next. Again, just a few more highlights here about, taking a look at our practices and policies and, asking ourselves, are we doing the work? Do we have the equity work in our 4-year plan? And what are we going to be doing to measure these outcomes? And I am glad to say that we do have these things in our 4-year plan, and we do have ideas to follow up. And we are actually, working to implement outreach right now before the 4-year plan even goes to print. So next slide. And this was one that was a little hard on the 4-year plan. Does our organization include diverse communities in the planning and outreach activities? And we did try to do actual inclusion and get into those communities, but it was a challenge. And so sadly, I will say that we don't have any direct voices in our 4-year plan reflecting kind of moving forward, but we've commented on the activities that we did attempt to do and the work that we tried to make happen. The heritage food bags were great. And through that, we did have, connections with Centro de la Familia and their directors and their leadership there. But again, there were some other ideas around LGBTQ outreach that were harder to implement. And the Native American community, they're working on some very interesting pieces in our region, and we hope to continue to connect with them as well. And so it's, something that we're going to keep talking about in the upcoming 4 years. And hopefully, for those of you who have been on the RAC, we have had, we did have Monica Snowbird from her organization present to us in the past year, and hopefully we'll have more voices from diverse communities presenting. And again, I'm grateful to Jennifer Horn, our staff person, who helped put this document together. And then as I also mentioned that, I will say in El Paso County, at the Pioneers Museum and at the Pikes Peak Library District, there is just an amazing wealth of very interesting information going on right now in February. There's a great exhibit at the Pioneers Museum, and there's all kinds of really unique books that have been highlighted at the Pikes Peak Library District. So those are opportunities that we can all take to kind of learn more, do a deeper dive, and have a better understanding, at least, of the African American community. And next. And so again, we've been really making a concerted effort on language. And, we did translate our yellow book into Spanish. We do have some of our flyers in Spanish. We're working on the website. You can click on the button to translate into different languages. But again, super important for us to be able to provide interpreters when we have folks that want to come and get services, that we have easy access to interpreter services. And as our family caregiver program does its outreach to the diverse communities and starts to kind of plant the seeds and seek volunteers, we'll be curious to watch and see how the different volunteers come through who do speak different languages and how we are able to implement that in. And there's other pieces here about just general language in terms of how we talk with people. And so I think the last point on the screen, does the agency or provider forms indicate inclusivity and equity? When asking about marital status, does the agency update the question to reflect relationship status, family of choice, et cetera, et cetera? So again, just seeking best practices and ways to change language on some of our forms and information where we're trying to gather knowledge about people that we're supporting and serving, so that they feel that we are being inclusive of them as well. And so next. And so a little bit about what cultural competency is. And again, something that made it into our 4-year plan, that we want to have opportunities to provide trainings, not only to staff and volunteers, but also to our partner organizations. And, so in order to show that we have cultural competency, does your organization provide ongoing cultural awareness, humility, and competency trainings regarding diverse communities? And I will say that in the next 4 years, our plan is to be doing a lot more of that. So stay tuned. And next, this just kind of talks about some of the work that was done with the 4-year plan that we did right from the beginning. And part of this was because the state did make it a mandate that we look at the questions that we did in the 4-year plan with a lens thinking about equity and inclusion, and trying to incorporate that, not trying, having to make sure it's in there. And so kind of an example of that was when we talked about, there was and you'll see this when you look at the 4-year plan, there's an actual category that talks about equity and inclusion. That's great. So we commented there, but then we took it much further than that. And so, for example, when we talked about outreach, we actually addressed and talked about equity and how we're going to be looking at equity through that outreach process and what we're going to be doing. When we talked about various services, we talked about how we want to do actual trainings with volunteers, as well as provide that as a resource for our contracted providers. And so we didn't just keep that equity piece just kind of siloed in the 4-year plan, but we actually included it throughout the other areas too, which was, I thought a great addition. And then, thinking about how are we going to measure these outcomes? And so that is kind of a piece to keep an eye on. We will definitely be thinking about measurements. Jim on the rack mentioned, with outreach, are you measuring things? And we definitely want to be measuring. So we'll be keeping that on the forefront of our work. And again, the next icon here, we are strongly recommending providers look into support around equity and inclusion, and what are they doing to do that outreach and do that work as well. And then again, the last piece here is really making a concerted effort to partner with other advocacy groups, organizations that do this work. And so we're not doing it in a silo by ourselves, but we are reaching out and, becoming more connected to HACEA, the Native American group, Centro de la Familia, and growing from there. So, really finding those boots on the ground groups that are doing the work and partnering with them, giving them what they need from us and asking them to come and support us so that we can do our work better too. And I think we just have 2 more screens really. And so I love this screen. Jennifer calls it a challenge. I call it an activity and an opportunity to explore. And so she says, identify 1 or 2 African-American, Black or African-American descendant influencers that have made a positive impact on the Black community. She doesn't want people to only think about the typical ones that come to mind, but maybe do a little deeper dive. See if you can learn about some other influential leaders, either past or present. And again, the Gazette in the Sunday paper has actually featured the places around our state that it's called the Green Book. I think some people might remember and have heard about the Green Book. And so it's featuring some of the places around our state where, when people who were Black really couldn't travel freely, they needed to know where they were going to go to spend the night and where they would be welcomed. And so the Gazette has been featuring those every Sunday, which is neat. So again, just an opportunity to do a little deeper dive, learn a little bit more, and then create an action step for the RAC, as well as the AAA, to help bridge the gap in the community and encourage individuals to attend our RAC and other advisory councils. And as you do that, remember to think about it from the perspective of, what kind of language do we use? How do we approach folks? How do we, make better connections, and just use it as an opportunity to think consciously about that. And then the last one is, I think she has identified her 2 people as examples of folks, and I think this is fun. So one is Damon Tweedy, MD, and he is an author of Black Man in a White Coat, a doctor's reflection on race and medicine. Jennifer chose him because he gives a voice and validation to the Black community when we discuss our fears and hesitation with the medical field and medical practice. So opportunities to kind of learn a little bit more there about the history of race and medicine. And then her second one is Mary Beulah Horn, her great-grandmother, being the first Black Tulsa police officer and pioneering a space for women, especially Black women. She created a legacy of change and provided insight into the Black communities while working to bridge the racial divide. So she leaves us with those two very interesting folks that have made an influence on Black history. And so with that, just a little summary again, that our 4-year plan fortunately has a lot of ideas and references and thoughts that were put in to increase our equity and our outreach efforts, and looking forward to launching those in the year ahead. Any comments, questions? Does anybody have any people who are Black that they would just share right off the top of their head that they have come across in the last couple of years? And Marilyn has her hand up.
Actually, I was listening to PBS on the way in here this morning, and they were focusing on a Colorado gentleman that died at 97 a couple of years ago. And he had grown up with Willie Mays and how he had gone through the baseball learning process with Willie and competed against him in high school games. And I found that very interesting to see how his life trajectory kind of mirrored what Willie Mays had done. And he talked about not knowing where they could eat and not knowing. So they took a fishing pole just in case that they needed to find a river. And it was because it was a story format with real people. It made more of a conscious understanding for me than if it was just reading something in a book. And that's what you presented here today. So thank you.
Great. Good example. Thank you. Perfect timing. Other comments, thoughts? Otherwise, I'll turn it back over to Madam Chair.
All right. Is there any other discussion items?
Marilyn?
Yes.
I just wanted to comment on the testifying before the state legislative committee.
Yes.
I had never done that before, but I find that I'm often, people pick up the phone and ask me to do things I've never done before.
And you accepted.
I accept. I think, oh, that sounds interesting. I just wanted to let everybody know that the process, I did it from a distance, so I did it from home. It was a very easy process. Obviously, Jody asked me to, and then of course I read the legislation, so I knew what the heck I was talking about. But then I simply had to go online and sign up to testify, find the right committee on the right day at the right time. That took a little effort. Sign up, and then on the day of testifying, you could sign into committee, but you didn't have any access to a microphone or camera in the beginning. But then when it came time, when the chair announced that you were going to be the second one or third one or whatever to testify, then suddenly the capability to turn on your camera became possible. And then when it became time to testify, now this part I didn't know about, you had a time limit, the 2-minute time limit. I know that for the future in terms of preparing my notes, but then suddenly your microphone turns on. So then, you have 2 minutes to make your statement. Now, I think I was about the 6th or 8th person or something to testify. And so by that time, everybody had stolen all my wonderful points, but anyway, I did a short little statement in support of the legislation. And then as soon as you're finished, you know, the microphone turns off and your camera turns off and it's all over. But you can still continue to watch the rest of the hearing, and then they voted. So anyway, I would suggest to anyone, if you're ever asked to testify or if you desire to do so, the process actually is very easy. And I would encourage you to do it.
Thank you for sharing that information, because I think that's was one of the reasons I was a little reluctant, was I didn't know what the process was. And you were brave enough to go right for it. So that's what we're all about. Each one of us, we're all actively involved, some more than others.
Didn't have to find parking or wait in line or anything.
Bill, did you have something you wanted to say? Oh, well.
This is Joe. I have something I'd like to add.
Hi, Joe.
Hi. Thank you for the presentation on equity and inclusion. There is a reference here. I don't know if you can see the book. This is what is The Invisible People of the Pikes Peak Region. It's by John Stokely Holly, and it was recently edited in 2021. It was edited by Tamika Jameson and Heather Jordan of the Pikes Peak Library District. They took a very deep dive and expanded John Holly's extraordinary history of Black people in Colorado Springs. So if you would like to know more about our own community and can do it very easily, this book is available through the Pikes Peak Library District. It is also available to be checked out, or you can buy your own copy. But I would urge all of you to, if you want to know more about the Black history in our community and who are the extraordinary citizens that have made a difference for us. I think if you start looking around the city, you will find statues of 2 or 3 people. Can you think where they are and who they are and why are they there? Can't think of them. Start just kind of asking your neighbors, see who it is that they would think about. But anyway, this is this is the book that will help you get started with a comfortable sense of, now I know. Try it. Thank you.
Thank you, Joe. Are there any other comments? Our next meeting will be March 23rd. And the next RAC executive meeting will be the first Wednesday of the month at 1 p.m. And the PPAGC schedule, that meeting's coming up, and that's when this will be presented. Is that correct?
The upcoming, we've placed the upcoming meeting schedule at the very last page of the current document attached to this invite for those of you who are online. Because the area plan is tucked into the board pack, the RAC packet. This comes at the very, very end, around to page 214, I believe. But there is an upcoming meeting schedule, and that's what this is referring to. So it's all of the variety of council meetings, committee meetings that are held here through PPACG, including the board of directors and some of the other subcommittees. For those of you who don't know, under the aging side of the house, we have our regional advisory council, we have the mobility coordinating committee, we have the Pikes Peak Commission on Aging, but without counting, there's probably 8 to 10 more committees that speak directly to some of the other work that's done across PPACG, very much like the RAC, helping assist having discussion and citizen input as it relates to some of the other funding. And so we've placed that schedule through April at the very, very end of your packet. So if you want to take a look at that, I think it'll give you an idea of not just the work that we do here as a regional advisory council and the area agency on aging, but across the PPACG and across the region. So
I attended the Pikes Peak Council of Governments meeting last month with Jody. And I had no idea what the Council of Governments really meant. There was someone representing all their Callahan, everybody was represented. I didn't expect a conversation on ozone layer, but you know, I found it really informative to know that those discussions were taking place and that the area truly is cohesive together in addressing whatever this issue is. So I would encourage you to look at that list, and if not attend, but you can zoom in also.
I think that gets sent, that information gets sent to us in an email, and attached is all the information. I know I haven't gone, but I look through it just to get the broad scope of all the things that agent, you know, that they do. So it's interesting to read that.
Just a question, this is Joe. I see that on this list, our next meeting is at 9:30 on the 23rd. Is that correct, or is it meeting scheduled time 10?
Let's say 9:30.
9:30?
So this is Jared, because I'm the person who put this together. That 9:30 is my calendar hold, so that I don't miss the 10 o'clock meeting. So good eye, and I just noticed that as well. It is 10 a.m.
Okay, good.
it is still 10 a.m., Joe. Although you're always welcome to come early.
Thank you. That's so kind
You
of
get
you.
first dibs on coffee when you do.
Okay, I'll do it.
Is there any other discussion? Meeting is adjourned.